Good day everyone, I'm Romano Ducas Sinining and welcome to Artist Screen TV. Today we're going to talk about nebulization therapy. So what is nebulization therapy? A nebulizer is attached to a flow of air or oxygen, converts a solution of a drug into an aerosol for therapeutic inhalation. What we're going to do before we start a nebulization. So we must do assessment. So what are the assessment? Assessment, the first thing to do is evaluate patient's need for nebulization. Second, evaluate arterial blood gases, sputum cultures, and chest x-ray. Third, review the physician's nebulization order for length of treatment and medication to be used. Fourth, assess patient lung sounds before and after each treatment. Fifth, observe consistency, amount of color of expectorated sputum. Sixth, assess need for additional physiotherapy to improve respiratory function. Last but not the least, for the assessment, assess the pulse and respiratory rate to establish the baseline data. Several objectives of nebulization: to deliver aerosol medication, to promote a better ventilation, to prevent or treat atelectasis, to administer mucolytic medication to lower the viscosity of the secretion and aid expectoration, to decrease pulmonary edema, to deliver an antibiotic to a patient with chronic purulent infection, for example, cystic fibrosis, to increase the work of breathing, to administer the bronchodilators for relief bronchospasm associated with respiratory disease, for example, asthma, chronic obstructive pulmonary disease. What are the equipment used in nebulization? Prescribed air supply, pipe, in cylinders or via portable air compressor, adapter, nebulizer apparatus or machine, mouthpiece or appropriate oxygen mask, for example, Hudson mask, prescribed medication, and last, sputum cup. In nebulization, there are 4 special considerations. First, the medication as well as its administration by air or oxygen is prescribed by a medical practitioner. Second, it may need to be diluted with a 2 to 3 ml of normal saline and is normally prescribed 3 to 4 times daily. The procedure, or the third one, the procedure may be coordinated with chest physiotherapy and may be administered by a nurse or a physiotherapist. And fourth, for the special consideration but not the least, for a patient with asthma, an estimation of peak of flow with tidal volume may be recorded before and after the nebulization therapy. There are main types of nebulizer. First, jet aerosol nebulizer. It uses gas under pressure. Second, ultrasonic nebulizers uses high frequency vibration to break up the water or medication into the fine drops or particles. And last, main types of nebulizer is high flow.
Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. 2. Know the actions, special considerations, and safe dose range. Purpose of administration and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand washing. Place medication on a tray or move the medication cart outside of the patient's room, or prepare for administration in the medication area. Transport medications to the patient's bedside carefully and keep the medication in sight of all times. Identify the patient by checking the name and identification on the patient's identification band, or ask the patient to state his or her name.
Okay, sir, ikaw si Raymart.
Oo, ako si
Explain the procedure to the patient.
Sir, today ma-induce the aerosol medicine.
Fill the nebulizer cap with the ordered amount of medication. Turn on the air compressor. Observe the fine spray from the nebulizer. Encourage the patient or breathe the nebulizer vapor through the mouthpiece. A mask be used if a patient has difficulty with the mouthpiece.
Sir, busin na kinikaroon sir ang atong nga aerosol sir or ang atong nga medicine para sa imong treatment.
Remain the patient until all solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist on exhalation from the opposite end of the mouthpiece or vents holes in the mask. Encourage the patient to expectorate. Ensure that the patient is left feeling as comfortable as possible. Wash and dry the nebulizer tubing and mask or mouthpiece with warm soapy water. Retain the equipment in the polythene bag.
Okay guys, that's all for today. Thank you for watching. Please subscribe to my channel, Artist Screen TV, for more videos and updates.